He's a general dentist, and we are recording this. Dr. Lekavich is a general dentist specializing in hospital dentistry, exclusively treats adults, regional center clients, and renders dental treatment at both UCLA for hospital dentistry as well as non-surgical services in his Culver City office. Next to him, Wendy Lekavich is the executive director, manages all operational issues of their practice, and she has 25 years of network development, management experience, and held a myriad of leadership positions at health plans, medical groups, and hospitals. So really glad to have them joining us tonight. And what we're going to do, I have a number of questions that I've gotten from the community, general frequently asked questions about dental care. And I'm going to be asking the questions. And at the end, you can put questions into the chat and we'll also field those questions. So have an open-ended Q&A. So starting off, our favorite topic, guys, COVID-19 and dentistry questions. And it's just not a Zoom session unless we talk about COVID at least once. But so the first question, I think people are wondering, are dental visits safe during the COVID-19 pandemic? And how do dentists protect themselves and their patients against COVID?
Dental appointments during COVID are entirely safe because dentists use what's known as universal precautions, which means we take great pride in making sure that none of the aerosols from our patients or us are exchanged. Having a mask, having eye protection, wearing hair protection, wearing a gown, those are all things that we do routinely. And during COVID, we continue to do that. Our masks might be, a KN or an N95 now, though. But yes, it's completely safe to go to a dentist during COVID.
And I've heard that probably in a dental practice is one of the most sanitary places you can be anyway. So that's another question, and I guess in general, but how best can one prevent a dental emergency during the COVID surge?
It's really simple. It's your diet and your hygiene. I mean, just two simple things. If you're going to be at home and you have lots of spare time, there would be no better time to brush and floss at least 3 times a day, as well as watch what you eat. I mean, high fructose corn syrup is probably the worst thing you can put inside your body. And that's in everything.
I'm removing the snack tray as we speak. And another quick question. So how does diet affect oral health as related to dental emergencies? And are there food alternatives that support oral health?
Oh, absolutely. I always try to tell somebody that if they really have to have a soda every day, that there's ways you can have something that's natural and as delicious as a soda. For instance, most people don't squeeze their own orange juice to make orange juice, but fresh orange juice is delicious. And there's plenty of sugar in the oranges themselves that it makes it much better, and it's much less sugar. It's not concentrated sugar. It tastes sweet, but it's not concentrated. What a lot of different drink companies have done is take sugar and concentrate it, and that alone gets between the teeth. And if you don't rinse your mouth out after you have some of that stuff, you're for sure going to get a cavity, for sure.
And what are some of the general ramifications of poor oral hygiene in general during the pandemic surges? Could the health of people with disabilities be compromised if they don't see a dentist regularly during this time?
Absolutely. There was a study that was done that actually August sent to me, that if you have periodontal disease and you're exposed to COVID and you actually catch COVID, that a lot of the outcomes are way more severe than if you didn't have any of that gum disease to begin with, because it's inflammatory. And anytime you're going to add a virus to an inflammatory condition, it's going to be able to do way more damage than it normally would be able to do.
I'd heard something about this, and also, are there underlying medical conditions related to oral health and COVID?
Oh, absolutely. Diabetes is one for sure, because when you're diabetic, your blood supply and your flow to certain parts of your body, like your gums, are not as good as someone that doesn't have diabetes. So you're going to have way more chance of getting periodontitis. And if you catch COVID on top of that, I mean, all sorts of things can happen because your immune system is compromised. And anytime somebody has, like even obesity, for instance, it's an inflammatory condition. Your body's being taxed with that. And now you throw in a virus, and it's a lot for your body to try to take care of at the same time. So not only are you more susceptible, but usually if you catch it, the outcomes are not as good as with somebody that fight it off real fast.
That makes sense. I think another question that people had, and I don't know if dentists are doing this, but are dentists doing televisits during COVID, and what does that look like? How is that different or the same from in-person appointments?
I'd like to refer to Wendy right here because she sets all those up for me.
Well, I don't, but actually, I mean, one of the things, I guess, if there was any positives in relation to COVID was the improvement of access for patients that can be seen in a tele appointment. So it's, you know, it saves a lot of time for the patients and for the families and the caregivers. And, you know, for our televisits, a lot of times what we're really trying to do is to holistically get to understand what's going on with the patient, not only, you know, with their oral health, but also if there are other challenges that we could possibly assist with, or at a minimum be aware of. So when we're working with them on their dental health, we're able to manage the whole patient versus just one specific issue. So so that in itself has been actually probably one of the positives, and we get that a lot from our patients as well. I mean, certainly when there's, you know, treatment that needs to be rendered, that's not done via a televisit, but a lot of the didactic and trying to diagnose things can at least be started in a televisit.
Hi, I just wanted
Well, I'm
to
thinking that would be my preference in general, but I guess you're right. You got to do treatment in person. And what exactly, how are the office protocols? And you mentioned a little bit earlier, but like sort of COVID, post-COVID, how are the office protocols different?
Well, you know, historically, and you know, it's a hit and miss, and you know, we want to be accommodating as much as possible always. But before, understanding that caregivers are working with multiple patients, and you know, sometimes it's very difficult to leave everyone back at the facility or at a program and just take one patient. But now we really don't. We have people, one patient at a time in our office. And so when a patient, where before everyone would come in, just like standardly you would in a doctor's office and be in the waiting room and wait. Well, now we have patients or their families or caregivers call from the car. And then once the room is sterilized and the previous patient has left, then the patient comes up. There's really no waiting in the waiting room or around the office, just because we're really doing our best to try to mitigate any challenges with COVID in relation to that. So, and you know, of course, you know, everyone is required to wear a mask. The other thing that we're doing, especially during this past surge, is asking for vaccination cards, proof of vaccination, not only for the patients, but for the caregivers or whoever's bringing the patient in. And it's really, again, we're not trying to cause more challenges for people. It's just to keep it safe. And, you know, knock on wood, we've been very fortunate in that regard. And we're just trying to be prudent as possible. So that's something else. The other thing, which is probably the least favorite of people, if you know, have made the decision not to vaccinate, we do require a PCR test no more than 2 days before we see the patient.
And do you think that that's a pretty common practice across dentistry and medical appointments, that a lot of providers are requiring that these same kind of precautions?
You know, I think so, but if they're not, they should be. That's, you know, and I mean, they should be in the sense that, you know, it's really not necessarily just protecting the providers, but also the patients, because if they're not vaccinated, I mean, it's everyone's personal choice, certainly, but we're more dangerous to them than they are to us, truly. So, you know, I mean, it is like, you know, for surgeries and whatnot, it's definitely universal, but I'm not sure in all the offices if that's happening.
Sure, sure. All right. Well, I know I'm going to depart from our COVID. I know everybody loves talking about it, but just, I know we have a lot of questions from folks about best ways to support oral hygiene. And one of the questions that we had was, how do we support oral hygiene in individuals with sensory issues or challenging behaviors who have a hard time, say, opening their mouths? What are some recommendations that you have working with some of these individuals?
Well,
Tom, can you hear me?
Darlene, yeah, we can hear you.
yes, why don't you answer that question, Darlene?
If I can be heard, I'm having a really hard time.
We're hearing you.
Okay. So especially with children, it's really important to work.
Okay, I don't know about everybody because I'm not hearing Darlene.
Okay.
Sorry, Tom.
It's unfortunately this is exactly what we get with Zoom. It's just not a good Zoom session unless you have technical difficulties. So Darlene, I'm gonna tell you, maybe we can am I the only person? I'm the only person who can't hear. Well, maybe I'm in my own Zoom session. All right, so Aga, I apologize, Darlene, if you can continue, if you can explain. So I guess everybody is hearing this.
Okay, so what I was just trying to say is that there is certain things that you can do, especially with children. Children are most of the time you can convert them over to dentistry, but you have to go very, very slowly, especially with sensory issues. I've worked with children for years, and initially you should be brushing their teeth from the moment they arrive. You should be massaging their gums. You should be working in their mouth so that they're used to having somebody in their mouth and not just stick a toothbrush in there after they've had their first tooth. So I know it's hard, but we did a lot of work with children using something like a rinse with ACT, and we would take the toothbrush, dip it in, and touch the child's tongue so they could taste it, and then remove it. And most of the time, if they get something they like bubblegum tasting, they won't fight it. And then you can go just tooth by tooth. You can dip it in and do one tooth. If that's all you can do for that one day, then that's all you can do for that one day. It's a very slow introduction. And sometimes you can mirror it with yourself. You can get your own little toothbrush and brush your one tooth so the child can see what you're doing, or maybe have him brush your tooth so that he can see what you're doing. And there's all kinds of tricks like that you can do, but it's really important to work with the child from the very, very young age. If they have no teeth, just brush their gums. Just get them used to having somebody working in their mouth, and you go from there. But there are dentists. We do have a dentist that is a behaviorist as well as, and she works with our children, Dr. Sashel, and she also has a child with special needs, and she's very good with working and doing those exact techniques, I'm sorry.
Well, I'm grateful that I could hear all this information. It turns out that I was the problem, but that's usual and customary. So, and so Darlene, I don't know if you want to field this or you guys. Another question we have is, if my child uses a water pick but not a toothbrush, is that okay?
I personally think that the water pick is great to rinse your mouth out after you've had a soda, but it does not do the job of a toothbrush. It would have to, the pressure of the water would have to be very high in order for it to remove plaque and debris from a tooth. And that would probably end up in doing more damage to the gums than, you know, a toothbrush. So I think a toothbrush is much better than a water pick. But a water pick for someone that will not ever floss, if they can use the water pick to try to go between their teeth, as long as they're, you know, they leave it there for a, you know, a decent amount of time, it's better than nothing. But flossing would be better than a water pick if they could floss, but if they're not going to ever floss, then the water pick is better than nothing.
So it's not a substitute unless you can get the water pressure like the fire department. Is that what? Okay. And another question that we have been asked a lot is, should people with developmental disabilities get orthodontics?
Well, that's a good question, because once you get the braces on a patient's mouth, they are very prone to decay. And if their oral hygiene isn't up to par, you might be, you know, sentencing them to cavity every single place they have a brace in their mouth. So that's the first thing you have to look at. But if the person's occlusion, which is the way their upper and lower jaw comes together, is so far off that they can't actually chew food, you have to do something for them. And usually in those situations, you need major ortho work to get the teeth to actually touch each other.
But you have to be committed to dental care.
Exactly.
If you're gonna, okay.
Or capable of it. There's some people that have a really difficult time with it. So it's not even a judgment. So for the regional centers, what we do fund usually is medically necessary orthodontics, where like Dr. Lekavich was talking about teeth that are, they're not, their jaw's out of place, or they have some real severe orthodontic problems. We don't usually fund the regional center for a cosmetic, just for the cosmetics, straightening your teeth. So because of that's one of the reasons. And anyway, that's just what I have to add. I'm seeing that when I try to go on video that they're saying the host won't let me in on video. So I don't know if that is something that can be corrected or not, just so.
We're just never sure what kind of outfit you're going to wear, Darlene. So. You know, another question, is there a specific toothpaste or a floss that you typically recommend for people?
I would recommend any toothpaste or floss they're going to use regularly. If they're used to a certain brand of toothpaste that they like the taste, but you know, they're willing to do it 3 times a day when they get up, after lunch, before they go to bed, then that's the best toothpaste for them. I can't say one toothpaste is better than another, or one toothbrush is better than another. As long as they do it 3 times a day, it's a good thing. I would recommend though that they should learn how to floss, and they have floss now on little flossers that are very easy to use. You can floss your whole mouth with one hand from all your teeth it might take about 2 to 3 minutes, but it's definitely worth looking into.
I have something to add to that, if you don't mind. Okay, sure. One of the things I think, if you can brush your child's teeth with water, that's just as effective as a toothpaste. And I think the dipping with a fluoride rinse, like the ACT, is sometimes less offensive. It's not so thick. It's not hard to get rinse out of their mouths. It's very light. And if you try that, that works a lot better in most cases. But I think that the toothpaste isn't a necessary thing. It's good, but it's not necessary. Just brushing the teeth is what's necessary.
Yes.
And how frequently do you suggest that someone should brush their teeth?
3 times a day. When you wake
up? Or after
up,
you eat, after every time you eat.
That's good too.
As we're going, my guilt level is just going worse and worse. So, okay, this is good information. General questions about how to prepare for a dental visit. How do you prepare for a visit if the patient fears the dentist, has a problem with white coats, medical attire, has had a bad experience previously? Any recommendations or modifications that you suggest to families in kind of preparing that individual to go to the dentist's office for a visit?
I can help a little with that if you don't mind, and then doctor can go after me. I
Okay.
think one of the things I think is really important is the when the patient doesn't realize what's going on. So what we did a lot of at home visits was put a light in the have them go into the mirror and put a light so they could see their teeth and they can see what the light is doing, and they can see count their teeth, you know, do a little counting, so that so they're really seeing and feeling at the same time what's happening, so it's not as scary. You can also have them look in your mouth, have them put a light in your mouth and count your teeth, so they get an idea about when somebody's coming in to utilize the dentistry, that they're not as fearful, because well, here we go, we're going to count your teeth, or here we go, let's look at with the light, how many teeth do you have? Very simple, sounds very simple, but it's really helpful, because you know, you just don't want to take somebody to a dentist where there's all these sounds and noises. And if you can get a last appointment, especially if they go into children, if they go into a clinic and they hear a lot of, you know, hand pieces going on. Adults, same thing. I mean, you can have them look in their own mouth, look in your mouth, just get a familiarity with what's going on and what the dentist is, explain what the dentist is going to be counting your teeth, going to look at your teeth, and you can go take it from here, Dr. Lekavich.
That was very good, Darlene. Because
You get an A.
what she was doing is she's switching positions. She's letting the patient see what the dentist does, so the patient knows that the dentist isn't going to do anything that's going to hurt them. So that's very, very, very good.
Well, and you know, I think that it's important to add what I was talking about initially in regards to the televisits, and before, when we would have people come in for initial evaluations, they may seem quick, they may seem like, well, why are we doing this? But part of that is just to, as I said, to really get to know the patient. The patient gets to meet the doctor, gets to be familiar with the space. It's just just taking a few minutes to just familiarize the patient with where they are, and hopefully increase the comfort level.
And in addition, I see that Dr. Lekavich, if people are afraid of individuals with white coats, he usually is in blue. So that might be helpful as well.
Yeah, and I don't wear a white coat, no.
And kind of a follow-up question that that one of the families had asked is, are there any supports for people with challenging behaviors when it comes to going to the dental office?
Well, yeah, there's people like Darlene, for instance, someone that'll desensitize the patient. And I've introduced Darlene to a couple of my families that have come into the dental office, and because they come up with that question exactly, like, how do I even start? And Darlene is very good at small steps. They do it small steps, one at a time. And bottom line is, if you practice enough, you can get anybody to actually come into the dental office. I've had several patients that were seen in the hospital, I mean, in the beginning, and then ended up being seen in the dental office after, you know, I took away all their dental problems, so their mouth didn't hurt so much. So it's possible. It's very, very, very possible. The person might be absolutely afraid because their mouth is hurting so much. And then once you take away the pain, they're willing to come in for their regular cleaning, exam, x-rays. It's not a problem.
Yeah, some of the people of our clients may never be able to have a handpiece, or, you know, have a filling filled, but they should be able to come in and have their teeth cleaned, or have somebody check out their mouth, or take x-rays. You know, that's like really a good goal for somebody that's hypersensitive. And then again, if you have somebody that's very, very difficult, that's what the anesthesia is for. And so, because we don't want somebody to have such a bad experience that they don't want to have anything to do with their mouth. They don't want people looking in their mouth. They don't want to have their teeth brushed, you know. So the most you can get done for somebody is to their benefit, I feel.
And, one family had asked if they can stay. I mean, do you allow family members to stay in the office with their loved one when they get the work done? How does that?
Yes, actually, most of the time I do, but you have to see how the patient behaves with the loved one in the room. Sometimes having the loved one in the room might make a person a little bit more irritated. And if that's the case, and I always ask the patient, do you feel more comfortable with this person in the room or not in the room? And sometimes they say, well, I don't really want that person in the room. I have to listen to the will of the patient.
Well, and it's nice because the way at least our office is that it's where the waiting room is, it's somewhat close to where the operatory is. So we just kind of leave that area open and let the patient know, oh, your mom is just right there if you need her, or but a lot of times Dr. Lekavich actually really likes having the family there or the caregivers, or just because everyone kind of knows what's going on and, is able to address some of the challenges after the visit, which is really helpful.
If it's a person's first dental visit, how do you know if they have any allergies? If you had any like allergic reactions to any of the anesthesia, or how do you screen for that?
Well, the thing is, if they've never, ever seen a dentist before, you can't, because it's going to be the first time that they're ever exposed. When somebody's allergic to something, they've been exposed to it before. And that's the only way you know you're allergic. So if they've never seen a dentist, you can't know what you could possibly give them that would make them allergic.
A lot of questions also came in about anesthesia and dental anesthesia. And one of them, is it bad to sedate someone to be able to work on their teeth? I mean, what if there are other procedures requiring sedation already, and we add one more just for dental work? I mean, is it bad to regularly sedate somebody, I guess is the question.
Well, in this day and age, the medicines they use to sedate people is a lot different than what they did even 10 years ago. 10 years ago, when you had general anesthesia done, you had to spend the night before the procedure in the hospital. You had to spend the day that you were in the hospital getting the procedure done, and then you had to spend another day to make sure you were fine before you were discharged. The medicines they use are very quick acting now. They're just as good, but they're out of the system, and they're basically through the liver and the kidneys detoxified much faster than they used to be. So anesthesia today is much, much, much more safe than it was even 10 years ago.
Well, and another thing just to kind of add, whenever we see a patient at UCLA under anesthesia, there's a very robust pre-op process where the patient goes to their primary care physician and or any specialist that is really monitoring their care very closely. And they actually have to be cleared no more than 30 days before, so it's as current as possible. So we're really looking at their overall self before even putting a patient under anesthesia. We have like I said, a really robust process where the primary care patient clears the patient. We review it in our office. We send it to the pre-op area at the hospital. They review it, and then the anesthesiologist reviews it. So, we're very, very fortunate that we've had virtually, all really wonderful outcomes in regards to that. But there's like a process to make that happen. Sometimes it seems a little stringent and a little much, but we feel like it's been very positive. So, that's why we continue with it.
So we had one family that said, my dentist said it's only safe to do the work once a year since my son has to be sedated. Do you agree with that?
Yes. Yeah, actually I do, because even though that the risk is less, there is some risk involved. So to do something that if you're doing it as an emergency, that's a different story. I mean, if they have, are they in pain, or a tooth needs to be extracted, or there's an infection, then yes, you might have to do it less than a year. But if it's just preventative, I agree. Once a year is fine.
And can a dentist do all the work in one day? Or won't that be too painful and traumatic if you're doing multiple procedures, or do you suggest doing everything at once?
Well, the way I've been told by oral maxillofacial surgeons, suppose you had to have 4 teeth extracted. And a lot of people go, well, that seems like to do too much in one day. What the facts of the matter is that if you do 4 teeth in one day, there's only 1 week of healing. If you do 4 teeth on 4 separate days, you've just multiplied the amount of time it takes to heal the patient. So it would take a month, as well as you multiply the chance for a bad outcome by 4. So it's much better to do as much as you can in one visit than to try to spread it out.
So if I have to go into sedation, should I do everything at once, my plastic surgery and my dental procedures, and just knock it all out at once? Is that?
There you go. There you go. That's what you should be doing.
Tom, did you hear what Tim said? No.
I hope not.
I don't know if I wanted to. This is a family friendly.
Okay.
And how do you know, how does the dentist know if the anesthesia is actually working?
Okay, this is something very, very important. The dentist should not be providing the anesthesia when he's working on a patient that's under anesthesia. He has one job, and his job is to make sure that the dental work he does is very, very good. You don't want a dentist doing 2 things at the same time. For instance, that's why there is no way I would try to put a patient to sleep and also try to work on the patient. You always have an anesthesiologist who's trained to do that in the room if a patient needs to be put to sleep. You're not trying to do 2 things at once. And the anesthesiologist would know by looking at the vital signs, the heart rate, the amount of oxygen in the bloodstream, the way the patient's behaving. Because if I'm working on a patient and the patient's moving, then that means the patient is not sedated enough to actually do the procedure. And that's the way I know if a patient's sedated enough. But that's really the anesthesiologist's job, is to make sure that the patient is very comfortable and sedated and isn't going to remember anything.
Okay.
Do you want me to, Tom, do you want me to like address like the pop-up questions or?
Sure.
I mean,
I just saw them
quick
come up.
answer.
Yeah.
I mean, I guess we'll share, contact information afterwards, but our office is located in the same building as Westside Regional Center. And as far as the payment for UCLA dentistry, it all falls under the medical portion of the insurance. They do accept LA Care, they do accept straight Medi-Cal, Medicare, most plans, but some of the plans they do not. But it falls, to answer your question, it falls under the medical portion of a person's insurance.
Look at that. She answers questions. She moderates discussions. She does everything. Thank you. Thank you. So some general questions about communication. And so one person says that my child requires a lot of patience. How do I communicate this with the dentist?
Just that way.
Go ahead.
Exactly that way. You can tell the history, give the dentist the history and what your experience is with the child and how they react to you, and let the dentist take over and let the dentist see what they can use, some of their skills to see if they can. Sometimes a parent-child is harder than a dentist and a child, or another person and a child, and there are, like I say, there are dentists that work with children and that are behaviorists that will help with that. So, I just think you have to explain. You have to advocate for your child, explain, but then trust that the dentist is going to be able to communicate with you what they believe that they can do or not do. It's case by case.
And how would the dentist communicate with a child who's, let's say, nonverbal, especially if he's uncomfortable or he's feeling any pain? I mean, how would he be able to communicate that if he had verbal delays?
Well, I look at the patient, and if the patient's nonverbal, it's difficult, but as long as you have a good history with the patient from the family or from the caregiver, like let's say the patient isn't eating, let's say the patient isn't sleeping, let's say the patient has a swelling on the side of their face, or their mouth is, they wake up in the morning with blood on the pillow. I mean, there's all sorts of things that information you need to get from the person that's with the patient the most. And if it's a family member or a caregiver, that's how you learn, you know, what a patient's experiencing. The three things that are most important is if the patient has a swelling on the outside of the face, that is a major issue. That patient should probably go to the ER, because that infection on the face can go up underneath the chin and it can cause some breathing problems. So it's a major issue. So if anytime somebody sees swelling, or let's say they're spontaneously bleeding, I can guarantee 99% of the time that patient has pain.
And are there other symptoms and signs that somebody should look for, that there might be a dental emergency or pain or some other kind of dental issue that's happening if the person's not able to communicate?
Weight loss. Weight loss is key. If the patient's losing weight and they haven't done anything different or changed their meds, and they're just not eating, that's the key right there.
They can also bang their head. They can also hit their head against the wall. I've seen that. I've seen where they bang on their face. You know, that's a very good sign that something's wrong, that, you know, somebody has to look in the mouth. But they will let you know. If there's pain, they'll let you know. And it's not hard in the dental office. You can tell, right, Dr. Lekavich, if somebody's in pain, you just go near that area and they'll flinch or jump or whatever.
Absolutely.
Yeah, whatever they do to have that be avoided, they don't want you near them. And that's a good sign that something is going on.
Absolutely.
You know, one of the most important things I think for a dentist to do, and this I know Dr. Lekavich does, and I've worked with a few dentists, that it's really important for, no matter what you believe, what level of understanding the dentist or the patient has, that you just out of respect speak to that patient and make eye contact with that patient and connect with that patient on some level, because there's so many beliefs that, oh, they don't understand what you're saying, or they don't know what you're doing, or it doesn't matter. It's a matter of respect. It's respecting that person, and whatever level you can get to connect with them on is what's really important. That's where you need to go with that. That's dentistry at its best.
Well
Human
said.
nature at its best.
Yeah, for sure.
All right, so some final questions we have. I know a lot of people have asked about just questions about supports from the regional center and insurance. So for people receiving services from the regional center, how can WRC support them as far as dental care goes? And how do I reach out for that kind of support?
Well, as a dental coordinator, at first you go through your case manager, and who will go through, if you have no dentist, and we can try to recommend appropriate dentist for you. For children, one dentist, Dr. Lekavich, sees many of our patients and does wonderful work, and I applaud you. I have to applaud him. And if they don't have insurance, we fund medically necessary dentistry. So that includes many things. It includes fillings and cleanings, exams, extractions. It does not include things like implants or gold crowns, which is, I've had that request before. But so all medically necessary treatment needs to be funded. If you don't have insurance or Medi-Cal doesn't cover it, we do. Because it's very, and they found how many health risks because people had problems in their mouth. We had people institutionalized that because their behaviors were so elevated and no one looked in their mouth. So it's really been an important thing to have dentistry as part of our program, but it needs to be, because we're not an insurance company, it needs to be medically necessary. And like I say, that covers most things. I mean, exams, all of preventive procedures. So they can reach out to their case managers. Will reach out to me if they have no one, then they need a dentist. Otherwise, we have the Dr. Lekavich, who will be more than happy to see some of our clients.
That's right.
And he's conveniently right upstairs on the 4th floor.
Does WRC do home visits for dental care, and what would that look like?
Okay, so we do have, and I am in the midst of working with one of our hygienists that have an elevated degree, and they can do home visits, Miguel. And so for adults mostly, and I'm just wondering, as we were speaking about integrating somebody in the dental field in the hygienist spectrum that would be willing to work with maybe children and go into the homes like I used to do. And I know they do that, and we do that. We fund for Miguel for people that have to have extra visits and can't go to the dentist 4 times a year. They go twice, and then Miguel will go twice, and he does things like working with the clients and their caregivers so that they can get better idea of what is necessary for that particular person or that particular client. So we are trying to extend that program.
And are there any additional supports for people with behaviors, let's say when it comes to brushing teeth or going to the dental office?
Well,
you know, I would actually tackle some of them. One of the things, if it's a consistent behavioral issue around dental hygiene, I mean, something that I might throw out there was we could certainly look at getting ABA or behavior modification specialists to work with the individual and to kind of work specifically on some behavior modification strategies to
that would be great.
To help with that.
There's a lot of good things that you can do. It's just trying to communicate that from one side to the other, like you're saying, to the behaviorist or whatever. What would be the most beneficial dentally for that person?
And question that we have, how do you navigate multiple dental insurances? Is it a good practice to seek cleaning and treatment from various dentists based on the insurance that they take?
Well, I mean, we can only speak for our practice, but and Dr. Lekavich can talk to this, but really our policy is that a patient needs to have one dental home. So we'd love it to be us, but if not, it really needs to be one, because each provider has a different way or a different outlook on what they may or may not want. There's the obvious things, but there are the other things. So it's our policy that, a patient has one dental home. And so we've had issues before where someone takes a patient to their family dentist for cleaning and then us for general anesthesia. It's just kind of, it gets garbled. And, anytime a new patient comes into us, what we request, we don't always get it, but what we request is, so we can a copy of the record so we can really see what's going on and what has been done in the past and the previous dentist notes. And so again, it's just like understanding really, what's happening with the patient and one professional making that decision. Do you want to?
Yeah, and I have to agree with what Wendy said, is that it's not that one opinion is better than another, they're just different, and it's a different path. And the thing is if you're going on one path and you're trying to get a patient to a certain part of their, their
oral
dental
health journey,
oral health journey, and then someone else says, oh no, there's a shortcut here, it's going to really change the way the patient thinks, and it's going to make it very confusing, because the more answers you give to one question, the more you would think you would learn. It's not necessarily that, because what the patient searches for is the answer that they most want to hear. Like if somebody told me, or if the dentist says, oh, you need to have that tooth removed before you end up in the hospital, and another dentist says, I would wait till it got really, really swollen and then I'd do something. I mean, that would definitely be different than the way I think. It's an option, but I think it would be a very poor option, but that's me.
So dentistry is not an exact science, and there's different ways of approaching, like Dr. Lekavich just said, exactly what he said. Somebody might be more aggressive, somebody might not be. So it gets too garbled, and most dentists really just want a patient having their dental home.
And I see that we've got some questions that are going to coming up in the chat. So we're going to get to those in a second. We have just two more questions that I had that were submitted to us before. What if someone doesn't have dental insurance? And we've certainly talked about if somebody's a regional center client that we can fund a lot of those services. What if it's a family member that doesn't have a dental insurance, and can they seek financial help for that? Or do we have any suggestions in general for people that can't seek dental insurance, that don't have dental insurance?
Well, for our clients, we fund that, but for family members, I'm not sure about, I've not come across that question at all. And I know that we have done in the past a little of that help if somebody was really in an urgent care, but mostly we stick with the clients and consumers.
And
I mean, you can get, a family member could apply for emergency Denti-Cal or Medi-Cal for an urgent need, and that happens, but it takes a while sometimes.
Well, and we do get requests quite a bit for families to be seen in our office, but our office exclusively sees adults that are regional center clients, and we want to make sure we have enough access for the patients that we serve. That's really the main reason.
And then a final question that was submitted. What if I can't afford having my loved one sedated or to purchase medications?
Are you talking about like medicine?
Regional center clients, yeah.
Antibiotics?
Antibiotics or painkillers, I guess.
Okay. Well, you're gonna have to.
Oh, well, I mean, as far as ongoing pain management, that would be something that, I mean, I couldn't talk to that, but I mean, one of the things that we do is do anesthesia in our office once a month with our anesthesiologist that comes to the office. But again, there's a medical clearance, the whole thing. And really a patient can only be seen in our office under anesthesia. And it's a much, much lighter sedation. But they can only be seen really if they clear medically. So again, that's not everyone. And, but that is an option to answer your question if you don't have medical insurance.
Yeah, we do fund that if you don't have Medi-Cal or the correct Medi-Cal.
All right, that's all the questions that I have. Stephen or Sandy, you guys mind just reading some of the questions that showed up in chat?
Yeah, I have a few questions. I think they've mostly been answered, but I want to, in the interest of being transparent, I like to ask all questions that have been posed. The first one is, I've contacted my son's dentist for an appointment due to tooth pain. I submitted the paperwork prior to COVID-19 started, and I haven't been contacted and my calls have not been returned. That was the first question. I don't know if anybody wants to address that.
Is it,
So
was it our
I
office
didn't-
or whose office? Whose office was it? Our office or was it regional center?
That was not mentioned. I'm reading the question straight. So
So they didn't, just to be clear, they contacted their office, the dental office, and the office never got back to them since COVID began. Is that what's happening? Then they need to call again. They need to find out where they stand. You haven't, you have to, if someone doesn't follow through or follow up with something, they need to call and find out what is going on. Are they going to see the client? Or is there a problem? Did it get lost in time and space? And they need to follow up, and then we can go from there. And if they need another dentist, then we can work on that. But if they want to see that dentist and the dentist hasn't gotten back to them, it's been a very crazy time. So there are cases that get lost here and there. So they need to either follow up or get a hold of their case managers and see what we can do.
okay. Second question. What are my options when my child needs general anesthesia for dental work? I have had to pay $1,000 out of pocket twice.
Well, we do have a dentist that does that we fund for anesthesia. Dr. Sechel, that's a child, does children. So they would either have to change their dentistry to a dentist to another dentist that is vendored with us that we can fund, because we do fund the anesthesia portion of it. That's the option that they have. Otherwise, it's, we're not able to fund a non-vendored provider. But if we do have some dentist that does anesthesia, and we can fund that, but it has to be our vendor dentist. Otherwise, we really don't have an option for that. We cannot reimburse parentally, or, it's not a regional center. They're not allowed to do that.
Yeah, and I think this question relates to that one directly, is where can we take our adult child for dental care that offers anesthesia in West LA area? And I think we're going to put, correct me if I'm wrong, but I believe we're going to put some referrals in the chat later, right?
Yeah, we can do that.
Okay. The next one was braces and extractions. That's all it says. So,
Well, that is sometimes needed for the braces to work properly, extractions, because there's not enough room in the mouth for the teeth. So if basically the dentist needs to remove 4 bicuspids, that's normal dental treatment for orthodontics. And it all depends on the patient, and it depends how much room they need. But extracting teeth for braces is definitely one of the things most orthodontists do if there's not enough room.
next question. My son, I believe, Dr. Kelly, this one might be one for you. My son had an emergency tooth reinserted in his mouth during COVID. My coordinator told me it was last year and I could not be reimbursed. I provided receipts and the dentist information. That was a hardship for me.
So the
Oh,
tooth.
no, it's for Tom.
Okay.
Yeah, I'm not, any help you can lend on this one, because I'm not entirely sure. So they're asking a year later for basically for reimbursement for a dental procedure. Is that right, Steven?
That's what it sounds like. There was no other
Yeah.
information.
So again, we can't, there's no way we can do parental reimbursement. I just talked to Caesar about this today, and that policy remains. There's no way to, most procedures have to be pre-approved. In cases of emergency, sometimes we can do verbal approvals, but there is no way to, there's no mechanism to fund somebody that is not vendored or if it hasn't been pre-approved.
And last question is, what are some techniques to increase the duration of brushing teeth? What can you do when the child removes the toothpaste and barely touches the teeth when brushing? And I think you answered this one.
Well, if the like Darlene said, something that tastes very, very good, which is that Act rinse that's bubblegum flavored. A lot of kids love that, and a lot of adults with disabilities, it's very pleasant tasting, and they would leave their toothbrush longer on their teeth if they, attempted to do that. And in today's day and age, there's every single flavor known to man. I mean, there's got to be something, some taste, but you have to experiment because, everybody doesn't just like mint or cinnamon. They have fruit flavor, they have bubble gum.
You can use water, you can use water. The thickness of toothpaste is a real sensitivity issue for a lot of people, for a lot of children especially, believe it or not. That thickness of a toothpaste. So what Dr. Lekavich was saying, the Act or just water or just a little bit of Act in a cup with a lot of water and dip it in and just try extending it every single time, one tooth at a time, just slow. But I think that toothpaste is a real turnoff. I've seen a lot of children that just don't like the toothpaste, and people put tons of it on and it gets all in their mouth. They don't know how to rinse it out, and it becomes a real issue, believe it or not.
And that was the last question that I had that came in through registration in Zoom. It looks like we have a couple of questions that were in Spanish that came through.
Yes, Sonia, if you can help us with that. I can hear you.
Did you guys hear this one, Darlene?
No.
So they're asking if the insurance will cover for deep cleaning. Would regional center cover for a deep cleaning?
Yeah, yes, from a vendor provider.
So, yeah, so the vendor,
It has to be a
provider
vendor
would have to be a
provider.
vendor of the regional center, but we would fund for deep cleaning.
Yes, we do all the time.
Just to add to that, Darlene, so the first step that Teresa should be doing, who asked this question, is she should contact her service coordinator and inform them that her daughter needs deep cleaning and that she wants help with getting it paid through Westside Regional Center if her insurance can't cover it.
Yes, but she has to be willing to go with one of our dentists, you know, like I was explaining, Dr. Seychelle is very good with children. So she'd have to change over to, and Dr. Seychelle takes insurance as well as Medi-Cal, and whatever Medi-Cal doesn't cover, we do.
Yeah, but thank you for clarifying, Sandy. Yeah, that would first step of the process would definitely be putting in a request to the service coordinator. And then we could work with that service coordinator to try to connect that family with that vendor provider.
Exactly.
And we have one more question. Please provide a list of vendors. Tom, did you want to answer this or did you want me to go ahead and answer?
Go for it, Steven.
What I would recommend is I would recommend contacting your service coordinator, talking to that person, and they can help get you some vendor dentists. That would be my first recommendation. Always the first line of defense is go with the service coordinator. They can always help. And I see no more questions in the chat.
Well, I'd like to thank everybody for coming and for joining us for this discussion. I really want to thank our panel. Thank you, Dr. Lekavich, Wendy, Darlene. Thank you so much for taking the time to answer all these questions. I think it's really important. And we're going to be continuing this series. The next one, we're going to be talking about medical care. And then we're going to also be talking about mental health care during COVID, because as much as we're preoccupied with COVID, during the pandemic, just general health care also has to take a precedent. So we want to make sure that everybody's taking care of themselves. And thanks again, everybody, and stay safe.
Smile.
Thanks, everybody.
Bye-bye.